color and any cracking or abnormalities on them. They look full and healthy, reddish brown color, no cyanosis, no erythema. Now in a moment when I look in the mouth, I'm going to be assessing his teeth for their color, any presence of dental caries, fillings, any other abnormalities. Going to be assessing the gums for their color, any swelling, any bleeding, masses or lesions. I'm going to be inspecting the buccal mucosa to see if it is for moisture and for any lesions. Going to also inspect his tongue for its placement in the mouth, any coating, any dryness, any lesions. Going to also check the soft and hard palate for color and any lesions. Going to assess his tonsils for size, any discharge, and color. And I'm also going to be checking the uvula to see that it rises symmetrically. That's going to be checking cranial nerve 10. So could you open your mouth for me? Okay, so don't see, could you lift your tongue up so I can see underneath? Great, so there's no visible lesions. Can you stick your tongue out and say ah? Ah. Okay, so the uvula rose up and it didn't go off to one side. And his tonsils, so that's proper function of cranial nerve 10. His tonsils were visible, but they were small all the way on the side of the throat. So I would grade them at a 1+. And he was able to stick his tongue out, so that's proper functioning of cranial nerve 12. And I'm going to assess the temporomandibular joint now. Can you just open and close your mouth for me? Okay. Alright, yeah, I didn't feel any clicking, any cracking, or anything like that. And his ability to open and close his mouth indicates that cranial nerve, let's see, proper function of cranial nerve 9? I'm going to go with 9. So, moving on now to the neck. I'm going to inspect the neck, look for symmetry, any bumps, lesions, or masses. I'm just going to palpate it. Yeah, don't feel anything like that. I'm going to test the function of cranial nerve 11 now. So could you just shrug your shoulders for me? Okay. Now turn your head against my hand. Okay. And the other way. Great. Okay. So he's got appropriate strength there. Seems that motor function of cranial nerve 11 is appropriate. And going to palpate the lymph nodes now, starting with the preauricular, posterior auricular, occipital, submental, submandibular, jugular-digastric, superficial cervical, the deep cervical chain, and posterior cervical, and the supraclavicular. Okay, I wasn't able to palpate any of the lymph nodes, so that indicates that there's no active infections in the area. Did you feel any tenderness in any of those areas?
No.
Okay, that's good. That's a normal finding. And I'm just going to palpate the carotid pulse now. So, okay, it's got a even, full, steady carotid pulse bilaterally. And now I'm briefly going to auscultate the carotid pulse, just checking for any bruit. Okay. Alright, so I wasn't able to hear any bruit in the carotid pulse area, which is a normal finding. And now we're going to move down to the thorax. I'm going to start with the lungs. So I'm just going to go behind you here and palpate the area of the lungs, checking for any bumps, lesions, or masses. Can you take a deep breath in and out for me? Okay, so there was symmetrical expansion of his diaphragm there. Now I'm going to percuss the lungs areas bilaterally, starting from the apex and I should hear resonant sound. And I'm going to take care to avoid the scapula and also the spine. Okay, now I'm going to auscultate the lungs, taking care to hit at least 10 spots, starting from the apex again. So can you take a deep breath for me? Okay, and one more. Okay, so I didn't hear any adventitious sounds, no crackling or wheezing, and I would go through and do another 10 spots here. And now I'm going to move around to the anterior. Again, I'm going to palpate starting from the apex just above the clavicles and just feeling for any bumps, lesions, or masses. And now I'm going to auscultate as well. So just take a deep breath for me. Okay, and another one. Okay, and so I'm going to go ahead and do 10 spots, taking care to avoid the sternum, and I'm going to finish up listening to the lungs laterally. So can you take a deep breath for me? Okay, yeah, I'll listen over here as well. Great. Okay, so I didn't note any adventitious sounds, and I'm going to move on to the heart now. So, starting off with, I'm going to palpate the 5 notable areas, starting with the pulmonic area, which is second intercostal space on the right sternal border, and going to palpate the aortic area, which is second intercostal space on the, I'm starting with the aortic, which is at the right intercostal, or the second intercostal space, right sternal border, moving to the pulmonic, which is left sternal border, second intercostal space, Erb's point, which is third intercostal space, just a little bit in from the left sternal border, the tricuspid area, which is fourth intercostal space, left sternal border, and then the apex, which is fifth intercostal space, midclavicular line. Okay, I'm also going to percuss just the base, Erb's point, and the apex of the heart, just checking for any enlargement. So here's the base. So it's a dull sound, which is to be expected. Okay, seems to be normal heart size range. And now I'm going to go ahead and auscultate on those 5 points with the diaphragm. And here I should be hearing S2 more loudly. Okay, and as I move down closer to the apex, I'm going to be hearing S1 more loudly. Yeah. Okay, and now I'm going to come back up using the bell, listening for any whooshing bruit. And I'm not hearing any whooshing sounds, so I'm not worried about any bruit in that area. And now I'm going to auscultate the apical pulse. Normally I would do it for 60 seconds. I'm just going to do it for 30 and multiply by 2. So. Okay, so in 30 seconds I heard 40 beats, which means that's 80 BPM, which is within the normal range. And okay, that concludes the heart. I'm gonna